Hey, welcome back to the podcast. Today, I want to talk about something that might shift how you think about your practice. You know that feeling? You're working with a patient who's been in pain for months, maybe years. You've tried different techniques, you've added modalities, you've done everything you know how to do, and yet they're still not getting better. Here's what I'm about to tell you. You might already have the tool you need. You're just not using it the way that it actually works. And that tool is movement. And I'm not talking about prescribing exercises. I'm talking about using movement as an education piece to actually change how your patients perceive their pain and their ability to get better and build resilience. This is what separates practitioners who see real lasting change from those who keep cycling patients through the same path. So stick with me. Hey there, I'm Jamie Johnston, and you're stepping into a new era of thriving as a massage therapist. We're embracing who you are, pursuing what you love, and confidently shaping your practice. We'll challenge industry norms, spark change, and discuss what truly matters. Things like mental health, evidence based practice, and some topics we've long avoided. Let's create better outcomes for our patients and happier, more fulfilling practices together. Welcome to the New Generation Massage Therapist Podcast. Let me paint a picture for you. A patient comes in, they're dealing with persistent pain, lower back, neck, shoulder, it doesn't matter. What matters is this: they're terrified of movement. Why? Because every time they move, they feel pain. And their brain has connected that pain to danger, to tissue damage, to the idea that they're broken. So what do? They avoid movement. They protect the area. They limit their life. And here's the thing: that avoidance actually makes it worse. They start becoming deconditioned. Their confidence drops. Their nervous system stays in a heightened state of alert, and pain and disability increase. Now, as a practitioner, what's your instinct? You want to help. So you learn a new technique, a new modality, and you think, if I just add this tool to my toolkit, I can fix this. But here's what I want you to consider. What if the problem isn't that you don't have enough tools? What if the problem is that your patient's belief about their body is wrong? And what if the solution isn't another certification course? It's learning how to use movement to show them that their belief is wrong. Okay, so let's talk about what's actually happening in their body. We know that pain isn't just about tissue damage. I know that's not new information, but stick with me because this changes everything about how you approach treatment. Your patient's nervous system is kind of like an alarm system. When there's a threat, either real or perceived, it goes off. And when that alarm goes off repeatedly, it becomes sensitized. It starts going off at lower and lower thresholds. So, a movement that shouldn't hurt, now it does, because their nervous system has learned to perceive it as a threat. And here's the kicker: their brain is doing this to protect them. It's not broken, it's not malfunctioning, it's just become overprotective, even when there's no threat. And because they're in pain, they start catastrophizing. They think, this is serious, I'm damaged, I shouldn't move. And that catastrophizing, it actually reinforces the nervous system's alarm response. So you've got this cycle where they go from experiencing pain to fear to avoidance to more pain. And it just keeps going around in that circle. Now, here's where it gets interesting. What if you could break that cycle by using movement to show them that the threat they perceive isn't actually real? What if you could use movement to educate their nervous system? And this is where most practitioners miss the mark. They think movement is about strengthening, about range of motion, about fixing the tissue. But what if movement is actually about changing a belief? Here's what I mean. Your patient believes that movement equals pain equals damage. And that's their reality. And as long as they believe that, their nervous system will keep sounding the alarm. But what if you could use movement to show them something different? What if you could guide them through a movement where they feel safe, where they experience that movement doesn't equal damage, where they realize their body is more resilient than they thought? That right there is not a modality. That's education. And it's really powerful. Here's why it works. When you use movement to show your patient that their catastrophic beliefs about pain aren't true, when they experience that movement is safe, then something shifts. Their nervous system starts to recalibrate. The threat level goes down. Pain decreases. Disability decreases. And the best part of it, you're not doing this to them. You're doing this with them. In your clinic room, in real time, they're experiencing the shift themselves. And that's what builds resilience. That's what creates lasting change. So here's what I want you to think about. How much time are you spending on learning new modalities? How much money are you investing in new certifications? And how much of that is actually moving the needle for your patient? I'm not saying modalities are bad, but I am saying this. If you're not using movement as an educational tool, you're missing the biggest lever you have. Because here's the reality. Your patients don't need another technique applied to them. They need to understand their pain differently. They need to experience their body as capable and resilient. They need to rebuild their confidence. And movement, guided, intentional, educational movement, is how you do that. And this isn't about adding more to your plate. It's about using what you already have more effectively. You already have the ability to guide movement. You already understand the body. You already have the relationship and trust with your patients. What you need is the framework, the understanding of how to use movement as an educational tool, how to guide patients through experiences that shift their beliefs about pain and their body's capacity. Now, there's a specific framework for how to do this. It's not complicated, but it does require understanding a few key things. How to assess where your patient is at emotionally and neurologically. How to introduce movement in a way that feels safe. How to guide them through experiences that challenge those catastrophic beliefs. How to use breathing and adaptation to build confidence. How to do this consistently so their nervous system actually learns something new. There's a simple guideline I use, and I teach it in detail in my course. But the basic idea is this. You're meeting your patient where they're at. You're moving them just slightly beyond their comfort zone in a way that feels safe, and you're letting them experience that they're okay, that their body is resilient, that movement isn't dangerous. Do that consistently, and you change pain neurotags. You decrease disability. You create real, lasting outcomes. So here's my challenge for you. Stop thinking about what new modality you need to learn. Instead, ask yourself, how can I use movement more intentionally to educate my patients about their pain and their resilience? Because that's where real transformation happens. I'm actually putting together a comprehensive course on exactly this. How to integrate movement as an educational tool into your practice, how to work with different pain presentations, and how to guide patients through the framework that actually works, and how to do it using a trauma-informed framework. It's coming soon, and if this resonates with you, I'd love to have you in. In the meantime, start paying attention to how you're using movement in your sessions. Is it only when you're doing an orthopedic test at the start of your treatment? Are you just prescribing exercises? Or are you using movement to show your patient something about their body and their capacity? That's the shift. Thanks for listening, and I'll catch you next time.